And so an engagement of healthcare right here universally is made known, and we are right here at Kempinski in the heart of Nairobi to really understand how we can advance healthcare and of course to the global level. What is the country doing to make sure we get to those positions? There's so much divided ends to really understand this and embrace this in the best way possible. What is the local communities doing to ensure that we have stable grounds as far as the health sector is concerned right in the Republic? And of course, because tutatumia lugha ya Kiswahili itakuwa rahisi kuweza kuelewa ufasaha na ufahamu zaidi wa masuala ya afya yanayochipuka. And of course, one of the best way is to come to these engagements and really understand this. If the local communities are doing this, the private and the public sectors are also doing this, how can we get to attain the universal level? WHX conversations are coming in handy to make sure that we have stable grounds in this. And in the next few minutes, I'll be introducing some of the stakeholders to really understand the empowerment and the engagement in due course. Kwa hivyo kama unajumuika nasi kwa mara ya kwanza, it is the first time that we are having this kind of conversation to make sure that we have the considerable engagement as far as the health sector is concerned. Join us until the end of the time. This is Look Up Television.
It is going to be a wonderful evening whereby we expect to have quite a lot, learn a lot, and also contribute towards this great venture.
As part of the WHX network, our Nairobi events deliver the same high value, exposure, connections, and deals that you would expect from a world-class healthcare exhibition. With the support of the Ministry of Health Kenya, WHX continues to be the leading healthcare and medical laboratory event for trade and industry and advancement across Kenya and East Africa. Today, we gather at the intersection of three powerful forces reshaping healthcare across Africa and beyond. These are universal healthcare coverage, primary healthcare, and health tech. As we engage in tonight's conversations, I invite you to look ahead to our landmark event taking place on October the 22nd to the 24th, 2025. This historic gathering will be East Africa's major global healthcare expo in East Africa, bringing together over 8,000 attendees and showcasing Kenya's healthcare innovations, investment opportunities, and advancements in medical technology. Thank you all for your presence and your participation, and I invite you to engage in what promises to be an evening of inspiring conversations and meaningful connections. Just before I go, I have been asked if you can register with the QR code that's on these leaflets. That would be really helpful. Enjoy your evening, and I look forward to speaking with you all. Thank you.
This is a public-private partnership where government envisages and also recognizes that it cannot be able to achieve all the mandates that it has been given by the Constitution alone. So the government needs to continue partnering strongly and closely with the private sector so that we can have health for all and also universal health coverage in this country. So I usually use the example of COVID-19, where the private sector really came in very strongly without caring who has what capacity or who has been doing what. And we saw a lot of good work being done by the private sector and government. So this is one of the landmark things that we always say in the ministry, that whenever we are called upon by the private sector, we'll always be ready to step in. And also when we call the private sector, we know that they'll always be ready to step in. Now, three things I was told to deliver in this meeting, that through the Overseas Development Fund, is actually dwindling and coming down. We all know about that. So we really need the private sector to step in. Now, and apart from that, we are faced by many other challenges, one of them being the climate change, which is a reality, and we need the private sector to come in and even step in and also model with us. And apart from that, of course, we are looking at issues of digitization and the digitalization. Private sector is very good in innovating and inventing. We want to welcome them in that space. And as we do that, we are working closely with World Health Expo and Congress, which will be in October as alluded by Daniel Green, where we shall be able to host the manufacturers, the suppliers, anyone who wants to start some investment within the country, issues of manufacture, anyone who wants to start some startups, we will be glad to partner with the WHX to give that opportunity. So thank you so much, each and everyone. Thank you, Informa. Thank you, WHX, for this great opportunity. We pledge our support, and also not just them, but we want to pledge support to every private person, faith-based, and also anyone who wants the government to step in so that we can be able to achieve universal health coverage.
We rebranded 10 years ago, so we are no longer the abbreviation AMREF. We are AMREF Health Africa. Before we branded, we were AMREF Research Foundation, the Africa Medical Research Foundation, and that name changed to AMREF Health Africa. And so on that note, I'll just speak briefly about AMREF and our partnership with Informa Markets, who's the organization that's behind WHX Nairobi. AMREF is the largest indigenous NGO in the continent, that is Africa, and we deliver programs to about 30 million people individually, of course working very closely with the government. We just had Dr. Lenai here, so we work very closely with the government. Here in Kenya, we work with the Ministry of Health. We have presence in about 37 countries, both in Africa and also in Europe and North America. We were founded here in Kenya, Nairobi, the Wilson Airport, and that's where we've been, and that's where our presence has grown from Kenya to the rest of the continent and the rest of the globe. In terms of what we do, our focus is on primary healthcare, people-centered, community-led health systems. And so our core pillar is delivering primary healthcare, of course, working very closely with the government and other partners. And so as a result, we've been partnering with Informa for, I guess, 3 years now. We first met in 2023 in Kigali when AMREF was hosting its conference, the Africa Health Agenda International Conference. And since that time, we've been walking this journey with Informa. Of course, then the Nairobi show was called Medic East Africa, or Medic East Africa and Medic Labs. Now it's rebranded to WHX Nairobi and WHX Lab. So this partnership has really been anchored on convening critical discussions. As you know, AMREF is a multi-stakeholder convener. So we hold critical discussions with key players because there's no one person or one organization that can get the health outcomes that we all desire for the continent. So we really convene multiple stakeholders to discuss some of the challenges, some of the opportunities that we have in health. And so as a result, our partnership has grown from, then 2023 to what we have now. And of course, some of the topics or some of the themes that we discuss are around UHC, primary healthcare, innovation, etc. Of course, WHS is also very strong in convening private sector, who are some of the partners that AMREF also works with. So we are excited to keep this partnership going. We are excited to keep this conversation going, and we're excited to partner with them again this year for WHX Nairobi. We're also excited to partner with them for WHS Cape Town that is coming up in September, and of course also for the WHX Expo that takes place in Dubai. So thank you very much for coming. We look forward to seeing you in Nairobi in October. And for those who are going to Cape Town as well, we look forward to being with you there and continuing those conversations, especially with a focus on the role of private sector in advancing healthcare in Africa. Thank you all and enjoy your dinner.
And we appreciate that you are part and parcel of the networking that we are having. 1, 2, 3, you clap for yourself, 1, 2, 3. And you clap for your neighbor who is just next to you. Put your hands this way. I have not said you slap. I'm saying we are going to clap for neighbors. Eh? Put them this way. Hi, you clap for them, 1, 2, 3. Which one is that one that has made some sound? Yes? And I want us to ensure that we are meeting. Now, left and right brings a lot of issues. Eh? I hope camera people, you will not really. Now, I want you to focus on your right only. Are we ready? Let's go. 1, 2, 3. 1, 2, 3. 20. Yes. Right. Left. Up. Down. Right. Left. One last time. 20. Wonderful, wonderful. That is an assurance. You can take your seat. That is.
So my name is Judith Anyona. I work for Women Lift Health as a program lead for the East Africa Hub. Well, it's been a good opportunity for me to network, for people to network within this networking session. For Women Lift Health, we brought on board about 8 women leaders for these forums, also just trying to amplify their voices in the space of health where they do work. So we are showcasing some of the work that women leaders are doing in their different spaces. Women Lift Health focuses on building the capacity, leadership capacity of women in the health sector. We focus on women who are in their mid to senior career level. And why we focus on women for mid to senior career level is because we notice that about 50% of women are at the entry level. Actually, 70% of women are at the entry level of health. But when you go upwards, as you go higher, the numbers keep reducing. The impact of this is that women issues are not represented. Their voices for advocacy are not heard at the decision-making table. And we need to change that narrative because women are actually there. They're present, but they're not available at the decision-making table. So we need to have more women at the decision-making table for us to be able to transform and change health outcomes. Yes.
The experience has been very nice. I've enjoyed this event, being a networking event, and where we are talking of a multi-sectoral approach in terms of dealing with our health issues here in Kenya. So we want to bring all the other sectors, all the players, all the stakeholders to ensure that we provide quality, accessible and affordable health. Currently, I can say yes and a no at the same time. That means yes, in as much as we have not achieved the full universal health coverage, but we are making good strides. We are making very good progress towards achieving it. Yes, of course, in any system there must be challenges, and Kenya is not unique. There are challenges. Of course, there are some other areas which are still facing difficulties in terms of accessibility of health and even affordability, because there are so many other factors that comes in when it comes to accessing health, including even transport network. So we are talking of other regions which are still having poor network or road network. So when it comes to accessing to the hospital and these medications, it becomes a challenge to them. Of course, we still have those problems, but then we thank God because of technology. And as the advancement in technology is coming in, it is also coming in handy to help us achieve this and bridge the gap that exists.
Health affects everyone, regardless of where you are, regardless of how educated or non-educated you are, regardless of your status. So it's a universal, I would say, thing. And so that's why I love it here. I've been affected by health issues, of course, as an individual. I've also lost people. So that's why the passion has grown to, what it is now. And I wouldn't imagine myself doing anything else other than this. To be honest, we find ourselves in a very complex sort of situation. And I say that because when you look at the way our health is designed, it was designed from the colonial times. And so a lot of our health systems are responding, or rather quite stretched now because of how they were designed. And so when you look at it keenly, looking at reducing funding from what has sort of enabled, the resources that have enabled health systems in the past is going down. And even when those resources were there, we were still struggling to meet healthcare needs for our people. And now that the funding is going down, it's even becoming much more difficult for us. And so I think what the opportunity we have is prevention, because as they say, prevention is better than cure. So whatever resources we have, we need to strategically invest in preventing things that can be prevented, ensuring that our people have good nutrition, good hygiene, vaccination for children, and of course other diseases that now have vaccines that prevent or at least reduces the severity, so that then we don't get to a point where treatment becomes so costly. So I think our biggest bet now is prevention, which is the whole essence of primary health care. Of course, we've seen a lot of effort from government and from other partners to really try to adapt to the current situation. We've seen a new health insurance scheme by the government. Of course, not without challenges, but those I think I would say are good initiatives that are trying to solve this problem, but it's really complex. So again, it still requires all partners to come together to again relook at what resources are there and how those resources can be invested effectively and can be optimized for good health. Yeah.
And how we can do this, I mean, right now we are looking at taking women through a leadership journey, which is 1 year long. But as we are taking them through this journey, we are encouraging them to also develop others. That's part of the responsibility, that as you're going up the health ladder, leadership ladder, you have to consider others, you have to mentor them and bring them up. Also, leadership aspect is not just the seniority in the level that you're in. It's how your presence in terms of how you express yourself, maybe when you're doing technical issues, when you're focusing on certain areas in health, that's where your leadership is felt. So it doesn't mean that you have to be at the topmost in an organization. It just means that you have to make an impact where you are. So using your voice, using your technical skills to be seen and heard within the spaces that you're working in. That's the focus that we are looking for. And you can do this by being your authentic self, doing your day-to-day job, but the beauty that women have in their leadership skills is that they have empathy. That's another sense that most humans don't have. So the empathy brings on board an issue that can transform the way policies are made, the way we advocate for health issues, the way financing is done, and overall looking at how health is impacted and the future of women and girls in the health sector.
Yes, one thing that I want to laud government is that it has a very good policies. So when it comes to policy framework, I don't doubt the government, we have them. So now it comes to the point of implementing these policies. And that is why we are coming in as stakeholders from all the spheres, all the characters and players in health industry, coming together to make it possible. Because after the government has given a policy framework, without these players coming together to do this thing, it will not be possible. Yes, and when it comes to are we really doing something as a country? Yes, we are. So what we need then to go is, in my own opinion, is to fully digitize health. When we fully digitize health, then it will be very possible to achieve this accessibility and affordability. Take a case of telemedicine. It's a technological advancement. And when you are talking of telemedicine, this is where you are able to talk to your doctor, a specialist who is far away, just on a video call. So you see, even if you are in a region where there is poor road network, but you can still get your doctor online and handles your case. Look at this issue where mothers are able to get alerts at home, the prenatal alerts and even the postnatal alerts. So in case there is any challenge, they can be able to take note of it as early as possible, and with that, then it will be a good progress. We will be going to achieve that sustainable development goal that we have in terms of health.
There's goodwill, what I can say. There's goodwill from the government, there's goodwill from the private sector. The thing is, we need to enhance our trust. Both entities need to enhance the trust, because I think there's always this feeling of people have interest, and it's okay to have interest, but then going beyond those interests to really trust each other, to be able to deliver sustainable healthcare, to be able to work together, to be able to come and co-create solutions that then would help communities. The other thing is also for government to articulate its priorities, articulate its vision, and support the private sector in knowing what those priorities are and how they can plug in. How do we integrate how we are offering health? Because again, it's still very fragmented. You'd still find funding going towards one disease area or towards whether it's treatment, diagnostic. It's still very fragmented. So how does the government help us to prioritize in an integrated way, so that you don't come and treat me for malaria and then I die of TB? So how do we integrate these services so that when one person is touched, then it's holistically, so looking at an individual from a wellness perspective and not from, this is a candidate for malaria, this is a candidate for this and that. So I think there's that is needed. And then also for the private sector partners is to look at some of the lessons they've learned, some of the efficiencies that they have that can then be adopted within the public sector.
I think I have been able to quite learn a lot, and I also see a gap in the medical field, mostly when it comes to technology, AI and robotics, and so I have an interest in wearable devices. My project that I am currently working on is on a wearable wrist device that's able to track someone's blood pressure, heart rate, and temperature, mostly for the pregnant women, to prevent issues of hypertension in pregnancy and their complications. And coming to WHX, I think I have seen they have an interface of the wearable devices, of the application of technology, and I think that's something I would want to learn more about, so that maybe in future I can engage with them and actually maybe take healthcare in Kenya to another level. Yeah.
In these wearable devices, how do you feel it will impact the health sector right here in the Republic?
So for the wearable devices, there's something that is portable. It's something that can be able to track the patient, and it's connected to a hospital. So the patient is able to be monitored wherever they are. You don't have to go to the hospital each and every time to be able to check your vitals and everything. So it will be able to tell you if your vitals is if your vitals are wrong, you'll be able now to visit a hospital, and it will actually even prevent complications that come about with delayed healthcare, seeking healthcare at a very late time.
Do you think it'll get to the universal angle?
Yes, I believe it will get to the universal angle. I think it's something that has been growing, and as I was doing my searches, I have seen that universities such as the Imperial College have started offering such majors in the medical field. So I think it is something that is growing, and I think it is going to revolutionize the medical sector.
Amazing. In the near future, we're expecting change and a greater height as far as now the health sector right here in the Republic is concerned. Even as we get the engagement more often, we are trying to make sure that everyone will understand this. So we are hoping for the betterment of the conversations and the engagements as far as health sector is concerned. You can also give us your opinion on your local local areas. How is the state of health right there? And what do you think the government will do as far as now the private and public sectors are concerned to make sure that we have stable grounds as far as the health is very key and it's very important. So as we channel these conversations and engagements, we have supremacy in the understanding of the health sector in the Republic. Ladies and gentlemen, this has been my time. Of course, you've listened to some of the interviews that we've done and the engagements and the insights, but all they are saying is, of course, the policies are there and everything is there. So what is needed is activation, and of course the empowerment continues all the way till the end of time. And because we are conversing about it, of course there's a greater tomorrow. So ladies and gentlemen, tuonane siku nyingine tukiangazia masuala mengine yanayokufaa wewe, kwa sababu tumeangazia leo hii, basi tupatane wiki ijayo tukiangazia masuala mengine yanayokufaa wewe. Now take a look, of course, all across our social media platforms. That is on Look Up Television, and that is on YouTube, Facebook, TikTok, Instagram, and across the divide. This is Look Up Television. My name is Moses Okech.